lung carcinoma, that is lung cancer. Lung cancer is produced by the prolonged inflammatory diseases like TB, COPD, asthma, and other chronic inflammatory diseases of the lung parenchyma. Due to prolonged friction, inflammation, the DNA of the normal tissue of the lung undergo mutation, that is the creation of abnormal or cancerous DNC occurs. This abnormal changes in DNC of the lung cells leads to overproduction, aimless production, and also harmful production of the tissues. Or we can say it is a limitless. It is not controlled by the orders of the DNA normally in every organ. So in cancer, the control of the replication is lost by the DNA. So a tumor is formed. That tumor produces various symptoms, that is pressure symptoms, that also metastasize in the distant organs and produces the secondaries. There are three main types of the lung carcinoma: small cell lung carcinoma, non-small cell lung carcinoma, and large cell lung carcinoma. Small cell lung carcinoma is very notorious, very progressive, aggressive, and fatal one. It is mostly produced by the smoking habits or the smoker, and it cannot be treated by the early or the initial surgical manipulations. Next is the non-small lung cell carcinoma. It is further divided into adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Adenocarcinoma is starting from the mucus secreting cells of the airways of the lungs. It is central in location and mostly occur in the non-smokers. It is a very notable thing. Mostly it occurs in non-smokers, whereas others type of lung carcinoma are mostly or 100% are present or caused by the tobacco smoking. Then there is a squamous cell carcinoma, which is located centrally, and it is also produced by the tobacco smoking. That is mostly prevalent in smokers, tobacco smokers. And large cell carcinoma, similarly, they are also prevalent in the smokers. Whether that smoking, that is the primary smokers, or whether that is the second-hand smoke. The smoke of the tobacco consists of hundreds of carcinogenic chemicals. When they enter in the lung tissue via airways, they produces irritation, and after prolonged use of tobacco or cigarette smoking, pipe smoking, cigar smoking, due to prolonged inflammatory and friction of the cells, that produces the abnormal mutation in the DNA of the cells and produces cancer cells in the lung parenchyma. So mostly it occurs after the age of 50 years, after prolonged use of tobacco. Next etiology is radon, radioactive gas. Also there are air pollution by the nickel, chemical, industrial chemicals, asbestos, and also there is genetic predisposition. In certain families, it is a congenital disease, that is the lung cancer. So these are the various factors that produces the cancer of the lung. Now the various symptoms produced by the cancer of the lung. There is dyspnea, hemoptysis, dysphagia, breathlessness, fatigue, loss of appetite, loss of weight, anemia, jaundice. Then there is collapse of the lung tissue due to the pleural fluid accumulation in the pleural wall, the cavity, pleural cavity. There is accumulation of the exudate that produces collapse of the underlying lungs. Mostly when it is exceeds the final stage, that is metastatic stage, then it also involves the peritoneum of the abdomen and produces peritoneal fluid effusion, and that produces the various pressure effects over the within the abdominal cavities, the various organs like liver, spleen, pancreas, etc. So these are the various symptoms produced, and also there are myalgia, also there is fracture of bones, bone pain, because these are damaged by the secondaries of the lung cancer tissue, which are deposited afterwards when it is spreaded by the metastasis process.